All right, and we are live. Just so everyone, all of our participants know, we still have a few people entering, and that is just fine. So this is in a Zoom webinar format, so you'll be able to see the speaker or the panelists. All right, and we are live. There we go. And you can enter in questions in the Q&A and in the chat. We will take most of those at the end. We might have a panelist or two that need to head out, so we might be taking some of the questions early, but just so you know, you can put them in the chat and the Q&A at any time. We may, however, wait to answer those until the end. But otherwise, you are muted, and we cannot see your video, so no worries there if you want to watch us in your pajamas today. Let's see, otherwise we are streaming live to a YouTube channel. I'll put that link in the chat just in case anybody wanted to also see that live stream, and that will have a recording on YouTube after we're done. Otherwise, I will just introduce myself quick, and then I'm going to let Nicole take it over. I'm Erin Farrell. I am the ASD specialist at the Minnesota Department of Education, and I'm hosting the webinar today, and I'm going to let Nicole take it away.
Great, I'm Nicole Burning. I am the clinical lead at the Minnesota Department of Human Services, and I am here with all of my teammates from the Autism Interagency team. Thank you for joining us for our third in this webinar series, The Pathway to Autism Services and Supports. And this webinar will be really emphasizing how to coordinate all of the services together. So we're providing a real high-level overview of the individual supports and how to access them, and then really going into some examples on coordinating those services. And so I will let the rest of my teammates introduce themselves before we get started.
Well, I'm Elise Holmes. I work with the Minnesota Department of Health in the Children and Youth with Special Health Needs at a section as an early childhood coordinator.
And I'm Dowds. I work with Metro EXU, and I'm the statewide specialist for ASD, primarily working with educators.
And I'm Dr. Jennifer Hall-Landy from the University of Minnesota. I work in the field of autism and early intervention. Thanks for joining us today.
Great, so we do have a few teammates that weren't able to join us for this call, but overall we are an interagency team across the Minnesota Department of Human Services, Department of Health, Department of Education, the Department of Employment and Economic Development, and the University of Minnesota Institute on Community Integration. And we meet regularly to continue to work to make sure that our services and supports across all of our different systems are coordinated and they work together for individuals with autism and their families. So today we're going to go through a few of these questions, hopefully be able to answer, what services and supports are available across our various systems, where you can go to get started accessing those services, and then go into some examples on how to coordinate those services. And we do have a wide variety of individuals on the call, so you'll see some things that are directed more towards families, you'll see some that are more for case managers, social workers, educators, other professionals in the field, providers of services and that type of thing. So hopefully there'll be a little bit for everyone on the call. And then of course at the end, we will take any discussion, questions at the end. And also Erin will be sure to send out the PowerPoint slides. So hopefully everyone can receive that. If you registered, you should be able to get the link with all of the different resources that we have throughout the presentation today. So to get started on what services and supports are available and how to access them, we created this resource as an interagency team that really breaks down some of the most common different types of services and supports that you would see across our different systems for an individual with autism, really across their lifespan. So from those early years, the developmental years, as they're going in and getting those healthcare checkups, and entering into the education system, maybe accessing home and community-based supports as well, and then thinking about more of those transition and long-term supports. So we're going to go through and break down each of those as we go through the next few slides here. So I'm going to turn it over to Elise to get us started.
Great. So a couple of the things that your healthcare provider or a clinic that you might go to can provide for you. I mean, the main ones that I would see for, or that you might see for either a pediatrician or a family practice provider that you would see would be the developmental screening and well child checkups. So developmental screening are those sort of screens that we had talked about in some of the previous webinars are going to be questions about, especially early on in your child's life from 0 to 5 or 0 to 3, questions about if they're able to sit up, if they're crawling, if they're doing these different behaviors, and if they're following along what we would consider a pretty typical pathway for development, and whether or not it may warrant looking more deeply into something or taking evaluation, as well as some well child checkups. So each of those things is something that's likely going to happen across any sort of healthcare visit. Now, the other things that are listed here, like receiving a diagnosis, some sort of initial history or exam, medications, or some sort of referral for something else, in addition to just seeing a pediatrician or just seeing a family doctor, that's going to be more of a generalist. So all of those things are not necessarily all going to happen because every child, every person is different. So really talk to your healthcare provider about what might be warranted, what might be helpful. If you are having issues with, something related to their movement, that maybe something around OT or PT could be helpful. If they're having any problems in sleep, then a sleep referral might be useful. So just ask about those types of referrals that may be available or where you may access those. So you can go to the next slide. And then again, like I mentioned, screening and monitoring, that happens often with your child's pediatrician, but you can also work with the Child and Teen Checkups program. That is your child's pediatrician or the family practice doctor that you work with if you are enrolled in Medicaid. That's kind of the setup that they work with, called Child and Teen Checkups. Another avenue is the follow-along program. So that's something that any family can sign up for. It's completely free. You just go to type in follow along program Minnesota and enroll here. And then you'll be receiving from your local public health department some screens that come in regularly, so you can kind of monitor your child's progress as they grow from 0 to 5. So if that's something you're interested in, you can enroll in that as well. And that's completely free and available to you. And the next slide.
Great, so we'll turn it over to Tammy.
Great. So services can also be accessed through your educational entity, so your school district. These services through education are free and they don't require a medical diagnosis. So this is something that you can pursue regardless of whether or not you have a medical diagnosis. I know we might talk a little bit later about the benefits of also having a medical diagnosis because it'll allow you to access other services outside education. For children who are birth through 5 before they've really entered the school district, you can call Help Me Grow Minnesota, which is an organization that helps connect you to the local school district, as well as has resources and additional help for you on the website. You're also able to access early childhood family education services, which you would do so through your community education program in your local school district. If you're wanting to refer your child who's over the age of 5 and is in school, you're going to want to contact your local school district directly. And then your school team, which would include the parent, will meet and determine the next steps, whether or not an evaluation is warranted, or maybe there's some interventions can be done within the school that will help any difficulties that your child might be having. Next slide. So a little bit more about Help Me Grow. Here's the information on how you can contact them. You can either call them or visit the website. Once you're connected with them, they will connect you, as I said, to your local school district. And then based on your situation, the school district might do an evaluation and intervention, and these services are able to start from birth. These educational services are free to all families regardless of income. And as I mentioned, Help Me Grow has referral information and resources designed for both parents and caregivers and professionals. They really encourage people to contact them with any concerns that they have about their child's development. Next slide. So the services that are provided once when the child has gone through an evaluation and qualified for services are available from birth through age 21 in your school district. Early childhood special education would be kind of the services that you would have for a younger child. For the evaluation, they will evaluate the developmental areas and provide individualized special education services. Starting at school age, your child would be in their school and also receiving individualized special education services. They may qualify for related services, including speech language therapy and occupational therapy. And your child will have what's called an IEP, individualized education plan, with a case manager or teacher on the team that is knowledgeable about autism spectrum disorder. I wanted to make another comment about the kind of special education in the schools, in that these services are provided in the student's least restrictive environment. So your child would be in the general education classroom as much as is appropriate for them. Next slide. Here are some of the services that are available within the education system. And you can see here just kind of a list, and I've talked about some of these. So again, these would be individualized based on what your child needs based on an evaluation and a meeting with you as the parent. Okay.
Great, thanks, Tammy. And so next would be looking into any home and community-based support. So if you would like some additional, more maybe intensive supports, or just to add in conjunction with those services that you're receiving through healthcare and education, these additional home and community-based supports, typically overseen by the Department of Human Services, can be another option. So some of these things might include case management services, which are really critical. Those are services that can really help you identify additional supports and coordinate those services. There's also some behavioral health services through the Children's Therapeutic Services and Supports program. That is for children up to age 21 and can provide both individual skills training to the child, psychotherapy sessions, and family group psychotherapy sessions as well. Then there's also the Early Intensive Developmental and Behavioral Intervention, or EIDBI services. Those again are available to children up until the age of 21, and they really are intended for children with autism and related conditions, providing some of that early intervention, behavioral, developmental approaches, typically on average between 10 to 40 hours of intervention services. So if that's something that you're interested in, especially for the younger children, even before they transition into school, that might be a really great option. So if you're interested in that, we'll talk about how to get access to those services. There's also different grants that might be available to help pay for devices, technology devices, communication devices for the child, technology for your home. Those grants can be fairly flexible and offer a lot of different options for different services. And then, of course, there are other providers that are providing occupational therapy, physical therapy, and speech and language pathology services as well. So to get started accessing those, typically your local county or tribal office is always a great place to start. A lot of those different services may require some additional financial assistance options, and so they can help you answer any of those questions about your healthcare coverage. You can also request a Min Choices assessment, and they will create a support plan based on that assessment. And they will come out and answer some questions about what your child's strengths are and what their needs are, and develop that support plan and really tailor some of those different services and support plan based on your answers to that assessment. Again, a great time to be asking about those case management services. A lot of those different programs that I talked about, those CTSS and the EIDBI program for children, they don't require case management, but it is a great option to also have the child determine eligibility for those additional supports. And then, of course, if you ever want to go on and explore your healthcare coverage options, you can also go online to the MNsure.org website at any time. We do also like to mention the TEFRA option of medical assistance. So we know many families don't qualify for straight Medicaid because their income may be too high. So TEFRA could be another option to be able to access all the other services that come along with medical assistance. There just would likely be a parental fee per month, similar to your premium that you pay for your insurance. So just an option to look into. And then, of course, a lot of those transition services, some of them start within your school district. And then there's also transition services that some of those community-based providers will offer as well. So thinking about as the child is growing up, even 14 is typically when we're looking at those early transition services to get started, and thinking about some additional behavioral health services that might be necessary as the child's going through some new social changes and different things as they're exploring employment and housing. So just thinking about those new social demands that might be present during that transition time. They also have different employment services, home care nursing, independent living options, home health aid may be something that the child might need as they grow up. Also continuing some of those OT, PT, and speech services. And then thinking about post-secondary education planning and maybe case management services again during this time. So to access any of those transition services, again, the local county or tribal office would be a great place to start. Requesting that MnChoices assessment to help determine exactly which supports are going to be right for your child or your family. And again, there's some of those grant options. We just know that as the child is growing up, their needs may be changing. And so continuing to go in and update that assessment and to get a new evaluation of what their continuing needs might be. Thinking in the long term, over the age of 21, there are also options. Of course, the waiver is available to anyone that qualifies, but especially for those programs that end at 21, sometimes those that need some of those long-term supports, the waiver is a good option for that, and offers some additional services such as case management, those employment supports, additional equipment and supplies, transportation, housing, and other options. So just another option maybe to be considering and looking into eligibility for those long-term supports. The Disability Hub of Minnesota is also a great resource to be checking into. If you have any general questions at all about any housing, employment, just navigating the system in general, going on to the hub is a great place to start. They do have a live chat that is open 8 to 4 Monday through Friday. So you can chat with someone or call them directly, and they can really help direct you to the best place to get your question answered. So a lot of great information there. And then we also have the Minnesota Autism Resource Portal website that really compiles all of the information that we shared today. And we keep adding new things and new information, but really it's just a nice, one-stop shop kind of place to go to that has all of the different services across the different systems. And it's a great place either for practitioners and educators and families to go and find all of this information. And then we have recently launched a Facebook page to coincide with the portal. So we encourage you to check that out. And we'll be highlighting different resources, sharing events, information, and things like that. So just another way to connect with the different services and support. So who else you might be able to connect with to help and support you throughout this Throughout navigating the system, we encourage all families to connect to some support groups or different advocacy organizations. They can be very helpful in assisting with the questions that you have and helping to navigate the system. Family Voices of Minnesota is a great organization. They have parents of different children with special health care needs, and they can connect you either based on maybe a similar condition that the children have, or even just experts in one of the programs that you're looking into, and they can help answer your questions and help you navigate through that, any questions that you might have. We also encourage you to check the Autism Society of Minnesota. They always have great trainings and programs and support groups available. Caregivers Connect is another organization that helps families bring them together and offer resources and supports. And then we just have a support group page on the Minnesota Autism Resource Portal. And that does have a few other more regional groups that are available. We encourage you, if you have one that we have not heard of or we have not listed on the website, to send that to us, and we would love to add that as well. But we just really encourage families to connect in any way you can. Right now, a lot of these programs are offering virtual support groups and meetings and different things like that to continue to offer that support during this time. And then those advocacy organizations like the ARC of Minnesota or PACER can be great, especially if you need someone to help advocate for your child during IEP meetings, or just someone to help you navigate. The ARC of Minnesota has great resources around TEPRA and different healthcare coverage options. They have a lot of great resources to help explain some of the more detailed information there. So then we just wanted to go through one example of how services can be coordinated together. So we really see effective collaboration across these different services to help establish these partnerships across educators, providers, and other professionals in the child's life to be really important to ensure that the child is accessing early screening, early diagnosis, and early intervention, and to really help streamline these referrals. So making sure that we're not just making referrals just for the sake of the referral, that it is actually meaningful, that the child needs access to that additional support. And just helping to make sure that those transitions are seamless. So especially those transitions between sometimes community-based providers going back into the school can be a little bit difficult. It's hard to go from 40 hours a week of intensive services in the home to that school setting. So how can we make that transition more successful? Same with a lot of other services that the child is receiving. And just making sure that we're coordinating our services so that the child remains in the least restrictive environment necessary, really across the home, school, and community environment. And that will just help to ensure those long-term best outcomes for the child and the family. So we really see effective collaboration to make sure that you're identifying the right supports and services across all of these different systems, and that the child is really being able to master their goals. So across those different service plans. So the child may have a treatment plan for early intervention. They may have an IEP for school, but making sure that those goals are all coordinated and that they're continuing to make progress or master those goals. And we really always want to see the family as driving that partnership and being the one that is helping to determine those goals and really strengthening that partnership and that relationship. And just making sure that the behaviors and the skills are generalizing across people and settings. It really doesn't serve the child well if they're able to respond, really well, maybe within just the center-based early intervention program, but they don't transfer those skills into the home environment. Just won't be as helpful. Same with if they're not responding in the school. So again, really why we want to see these coordinated services across all the different systems. And we know it hasn't always worked seamlessly, but that's what we're trying to improve, and we're trying to give everyone the resources to help that collaboration. So really emphasizing what other providers and professionals have to offer. So just understand that sometimes certain programs, certain intervention services are very structured, and that might be what the child needs for a certain period of time. But then we know that the end goal is, of course, to be moving them into a more natural setting, that more natural environment with those more natural level of supports. So just understanding that that is the end goal. We don't want to keep the child in those highly structured environments. Creating those generalization opportunities, right from the beginning, we need to be programming those generalization opportunities in, and really making sure that from the time that we're writing our treatment plans, that we're thinking about coordinating our services and making them as comprehensive as possible. So across all of these different programs, you'll see, different treatment methods being offered. We're going to talk about some of those resources that you can help you decide which of those resources or different treatment methods might be best for your child and family, because it can be overwhelming. How do I decide which, might be best? This professional is telling me I need to get my child into OT. This professional is telling me I need to get my child into speech. The school is telling me I need to go into this program. How do I decide, and how do I make time for all of those things? And just how, as a family member or caregiver, how can you make sure that your voice is heard, how your child's voice is heard, make sure that you're being incorporated into the goals at all times. And of course, it just helps because right now we have an overall shortage of providers. So we really do need to make sure that we are coordinating and providing supports across all of our systems, just to make sure that the child is receiving enough supports that they need. So one example of the coordination that we are really trying to encourage right now is between those early intervention, those EIDBI providers in schools. So we always emphasize that professionals, according to your legal and ethical guidelines of your professional licensure or your certification program, you do have an ethical obligation to coordinate services across those providers. So that's just one thing that we like to highlight, that really any professional likely has an ethical guideline board that they're following. So they really do need to work on those collaborative approaches. So then guidance between our state agencies. So we get a lot of questions of, is this something that we support? And of course, this is between the Department of Education and DHS. We both, support that Medicaid covered EIDBI services may be provided concurrently, depending on the individual needs of the child within the school district or outside of the school district. So they could be in combination or happening concurrently as well. And the law does not, prohibit nor require the provider to be able to go into the school. It is dependent on each individual school district, but we just want to make it clear that there is no law prohibiting the provider and the schools to collaborate. I don't know, Erin, did you want to jump in there at all?
Yeah, if you think about what is the goal in providing that collaboration, it's really ultimately to how do you best serve the family that you're working with, and ultimately the child or individual receiving those services. And if there's better coordination, if we're all working towards similar goals, we can have socialization goals, for example, in EIDBI services, as well as in special education. And if we're working on the same things, we're only going to help that child or that individual reach those goals, that much more quickly, or, really learning together and finding out what are the supports needed to reach that goal, versus, doing things very differently and working against each other, even as simple as using similar language instead of conflicting language and that sort of thing. These are some of the things that we're looking at, and why it's so important for that collaboration to happen. And we are hopeful to continue to foster those collaborative relationships. So as is shown on this slide here, so we are looking at, and we are overviewing in the collaborative process to make sure that we are providing in special education or within schools. Students have a right to a free and appropriate education in the least restrictive environment. And EIDBI is something that can support that. It's not necessarily, it's a different service than special education, so it can't be provided instead of special education, but we can collaborate. As many of you know that are listening today, autism spectrum disorder is not just something that we see isolated in school. It's something that we see across 24 hours a day and across the lifespan. So when we can actually provide services within school that help to support those community and school-based services with EIDBI as well, all of the services that we're providing are more effective when we're working together. One of the things that we've found in the collaborative process that has been kind of a barrier for some teams is the privacy, and making sure that for EIDBI providers, for example, they're following HIPAA, and in our special education, we're following FERPA, and there's no conflicting requirements for either of those. What it really takes to make that work is consent from the family and caregivers for information to be shared across school and home environments, so that you can have those conversations about how to collaborate and what you're working on and all of those things. So as long as you're obtaining consent and following your own accountability, you'll be fine within that process.
And then we just offered some guidance on the different treatment planning. So I know we kind of talked a little bit about this already, but just making sure that, again, those goals across the two different plans are coordinated and really reflect those collaborative goals. So things that are not contradictory to one another or kind of working against each other. And Erin mentioned the communication. So again, just making sure that things, line up. A lot of times, we just maybe call a program a certain thing, or we call a behavior a certain way, or, a treatment method a certain way. And that right there can kind of already start to alienate certain providers or family members if they're just not familiar with the terminology. Especially with all of the acronyms that we love to use and things like that. So just really be thinking about how you can make everything be very plain language and accessible for all of those different providers who you're sharing your treatment plans with. And just making sure that you really explain the program implementation. So not just reading off or listing the goal, but why are we targeting this? What is the goal that we hope to see with this objective that we're putting in. That way we just make sure that things are consistent, all team members are on the same page, and everybody is implementing things in a similar way. That way we'll see things be most effective for the children and family. So one document that we created to help facilitate these conversations is called the Give and Get document. And this is available as an e-doc that you can search through the Minnesota Department of Human Services website, or I have the link here that you'll receive when you get the slides. But this really just goes through and outlines really what each different party that is involved in this collaboration, what they might be getting, and also what they might be giving through this partnership. So the EIDBI providers, how they're benefiting, how the school is benefiting, what the child and family are benefiting, and what are some of those shared outcomes. So this can be a great tool and resource to just sit down with those different individuals and really talk through this plan. And then we also have the Memorandum of Understanding Agreement. So Erin talked about a lot of those legal requirements and the privacy concerns that are outlined typically when trying to coordinate services across providers. So this is just a template to get started, signing a contract that really outlines some of those the guidance around the legal requirements and the privacy concerns, and signing those disclosure agreements, and talking about really what the roles and duties and responsibilities of all of those different parties involved might be, and coming to an agreement and having that signed and something that you can have on file and keep as part of this collaboration. So just another resource that you can utilize. And then one question we get often is just how are we determining, what best supports that might be available. So of course, we talked about those Min Choices assessments that can really be helpful across the different, a lot of different services and different systems of support. But a lot of people are familiar with kind of the tiered level of supports that you see in the positive behavior supports through your school district. So this is just something that we developed as well to kind of go through what educational supports might be in place for the child across those different tiers, and then how EIDBI services might fit into those. So of course, where there are those more intensive individual needs, that's where we might see either the child leaving the education setting for a period of time to receive one-on-one EIDBI services, or maybe receive in a combination of both together. Throughout all of these, different tiered levels of supports, there's that family caregiver training and counseling part of EIDBI services that is offered. And that can just be great because sometimes, I know schools are challenged to sometimes have that family engagement process. So those community and home-based providers might be able to help fill in some of those gaps. And of course, at any time, if it's more the child has successfully transitioned into the school setting and they're doing fairly well with the supports that are available throughout the school, just making sure that EIDBI provider could come in and provide consultation or any follow-up if any challenging behaviors may start occurring, or if there just are any questions. And I know we had received some questions, and right now EIDBI services could also be helping with some of that distance learning. So of course, they're not working on academic tasks because that would be a duplication of what the school district is providing for the child, but they can be helping out just to manage some of those behaviors to make the distance learning more successful. So helping to increase attending, maybe working on skills to help the child be fluent in attending to a computer screen or an iPad, or whatever mode that they're receiving the distance learning from. So they definitely can be a part of that and be helpful. And then we also have a resource, the Week in the Life form. And this can just be really helpful in laying out all the different services that the child is receiving across different providers, just to see, is there really time in the child's week to make sure that we are accessing all of these different supports. So this can just be helpful. I know a lot of times, you're feeling like you want to just be able to go to the school, be able to go to speech, be able to access, maybe a music class on the weekends. But is that really feasible? Are we able to get all of those things in logistically? So, so this can just be a helpful tool to help coordinate that. We also encourage families and different providers to establish a really clear communication or progress check-in. So having maybe either a daily or a weekly check-in. It can even be something as simple as a logbook of each provider that's just talking about maybe what they've worked on throughout the day or the week, what they've accomplished, and what they want other providers or professionals to know in the child's life, as well as the family. It can also be really helpful for the family to share communication, especially if you are trying out like a new supplement or a new diet for the child, maybe even if they just didn't sleep well the night before. It can just be really helpful to keep that communication and progress check-in going on a regular basis. And we just really encourage that as more of a positive check-in and proactive check-in rather than waiting for things to not be going well or the communication to break down before we start to schedule those events. Another helpful tool we just recommend is called the Referral Log Template. And this is just for families. We know as you're calling different providers and you're following up on appointments, to just be keeping track of the dates and the people that you called, and their contact information, and maybe what those next steps or the appointment dates are. Just having all of that information available in one place. Again, it's just helpful to see all of that and again, be able to help coordinate those services together. So just some overall tips, make sure that you have a list of important people in your child and family's life, contact info, how they're supporting you. That can be very helpful. Again, transferring that information, making sure other people are aware of who else is able to support the child. Really staying organized, creating a binder, having all of those consent documents, any copies of evaluation, test results. I know a lot of times, families share that they, are frustrated with having to answer the same questions or redo the same evaluation over again. And a lot of times that just happens to be because that new provider doesn't have a copy of those past evaluations or they can't share those results. So if you have a copy and you can share that, likely a lot of times that can help minimize those repeated evaluations and assessments. And just making sure that you are, signing release forms, offering up that information so that that's not a barrier to providers collaborating with each other. Again, planning those meetings, making sure all of those critical individuals that are working with the child are available. We always encourage you to share information with data, backing up any of your recommendations with data is very helpful as part of these collaborative approaches. That way we're not sharing kind of this is my opinion or this is my subjective approach to treatment recommendations. I do support my recommendations based on data. And a lot of times data can just be shared a bit more visually with individuals across different teams, and it's just easier for many different professionals to understand those outcomes or those results. And just know that as a family or caregiver, you know your child's best. Even those providers might have unique expertise, but you do know your child, so always feel like you can advocate and feel empowered to ask for the things that you feel are best. And if something's not working, always feel like you can speak up and share that with providers as well. We also encourage, group emails across the different providers. Again, this can be just really helpful, making sure everyone's on the same page. If there's different changes, it just goes out to everybody all at the same time. And as Erin mentioned, we're all working towards the same goal of really determining what's best for the child and the family. So resolving any conflicts or any of those, disagreements based on the best interest of the child. We also have a guidebook that's available on the Minnesota Autism Resource Portal website that can really help walk you through all of these steps and has a lot of tips on setting goals, tracking outcomes for your child and family, and different questions that you can ask yourself to really help determine, is the service and support helping my child? Am I seeing the results that we should be? Just ways that you can evaluate your current providers. During COVID, we do have a lot of different resources. Providers are still offering services, conducting screenings and evaluations. I know there were some questions about the timeline and the wait list. Oftentimes they are fairly long and they have been made even longer because of COVID. But get in touch with us and we can try and help see if there's anything we can do to help coordinate some of those faster getting in and accessing a provider. But stay on the wait list and make sure that you have an appointment set up. And then we do have a list of resources on the Minnesota Autism Resource Portal and a distance learning and disability services guide for children, a case manager guide, and ARC and PACER have also put together really great toolkits during this time. And Erin, did you want to share about the MDE resources?
Yeah, if I can share my screen really quick, I can actually open these up just to show everybody where they can find them. 1 second here, I should have had that pulled up. I was putting some stuff in the chat for everybody to get access to, so I will start sharing my screen here quick. All right, so so some of the things that we have on here, I just want to show you how to navigate if you're looking for any of the educational resources, because it is difficult to navigate looking for some of these things sometimes, but we've tried to keep the COVID-19 pages very upfront on the Minnesota Department of Education webpage. So I'm just on the homepage right now for the Minnesota Department of Education, and on the homepage you can see there's a COVID-19 updates page you can click on, and so I can go right into here to see what all of these executive orders and new information that's coming out. What does this all mean? You can find them all here. You can find information on safe learning and plans and all of that, and as well as how closely we're working with MDH and information related to schools. What I'd like to show you really quickly is if you want to stay updated on any of these things, you can sign up for updates to receive email notifications on special education, for example. So I might actually go into the special education page here because I do think that this is pretty nice to navigate now. So they've kind of changed some of the things to make it easier to navigate with COVID-19 resources. So you can look in here and find information on special education instruction services and programming. And there was oh, look at this, is updated today. I haven't even seen this today update yet. But this is this document, well, the Q&A came out earlier, but there's now some updates. As you can see, we're updating even from when this came out on 11/5 to now today. There are some updates on determining in-school direct services and in-home direct services. So you can navigate to that document right here and get an update as of today. There's also information you can find in here if you're looking for due process guidance and some special questions and answers on due process you can find here, as well as early learning. Oh, I thought there was a few things on there. And then resources for families is the other one that I just wanted to highlight really quick. You can link here to find some different things for distance learning and special education and some of those supports that Nicole's already gone through. So just wanted to show you really quickly where you can find that information and how to navigate to it. And I will turn it back to Nicole. And I have been dropping some of the links for some of these things in the chat as well. And we will send out the PowerPoint. It is just, I'm just a little delayed in getting those out right now.
Great, thanks, Erin. And we just wanted to share that we do also have the ASD strategies and action training that is always available to anyone in Minnesota free of charge. You can just contact us at the ASD email inbox that's listed on the screen there and request access. And this is up to 40 hours of online training. And it's really tailored for anyone, families, educators, providers, other professionals. So it can always be a great resource to take yourself or to share with others. And we also have a cultural responsiveness training that all of our autism service providers are required to take, but is also available and out there for any professional that is interested or even family members to be able to take as well. And really kind of goes through those different assessments, treatment planning processes, and just some suggestions on having individuals in your home or working with providers in a center or different settings. And again, just something that can really help that collaborative approach is to have some of that cultural responsiveness training as well. So now we will open it up for questions. I know we've been trying to answer some in the chat as well. I will say if you do have kind of a more personal or specific question, it might be helpful to just email us directly with that question, just so that we can help kind of go through your more personal details or information with you. But otherwise, yeah, we'll open it up for any questions that anyone has. And we do just have other resources. We have the recordings for the webinars online here. all the links to the resources that we mentioned today, and then just that ASD inbox. But I will look here in the
Yeah, what I'm going to do really quick is I'm just going to end our stream because I think there's some pretty specific questions. So I will end our recording and you will be able to access this on the YouTube channel that I put on there. So thank you very much.